Hey, everybody, and welcome to another episode of Rebel Reflections, the Rebel EM Book Club. Today, we're going to be discussing a very interesting and insightful book by Steven Kotler. But before we do that, I'd like to introduce the gentlemen on the other side of their respective microphones, Drs. Marco Propersi and Daniel Wolf. Dr. Propersi, let's start with you.
Hey, folks. I'm here in the Hudson Valley region, and my name is Marco Propersi. I'm vice chair in APD and regular contributor and content creator at Rebel EM.
All right, Wolfie, go for it.
Hey, my name is Daniel Wolf. I'm coming to you from Brooklyn, New York currently. Will and I went to a residency together in upstate New York. Currently an EMS fellow with Maimonides Medical Center.
My name is Will Smith, and I am an EM doc on the other side of the country in Northern California. In addition to doing a little bit of audio for Rebel EM, I am also one of the Emracast podcast co-hosts. As I mentioned at the beginning, we're going to be discussing a book by Steven Kotler, Kotler, and it is called The Rise of Superman. For anyone who hasn't gone through this book and is interested, there's going to be a link in both the show notes as well as the blog post that'll take you right to it. And keep in mind, our goal with Rebel Reflections is to take a book that isn't directly tied to medicine and see how it applies to us as ED physicians, but also as partners, parents, friends, and overall human beings. I think that this book really lends itself to that. Dr. Propersi, I'm going to have you start us off with a very superficial bird's eye view of the book, and then we'll dig a little bit deeper.
The main ideas are about this concept called flow, and I think extreme sports athletes would talk about being in the zone, or this ultra level of consciousness where they're kind of in peak performance or high level, highly functioning states. So I guess the question for us is whether or not we could get into these similar situations in emergency medicine, or how they relate to emergency medicine. Now, one of the things I really like is that Steven Kotler, I think, started his career as a photographer for extreme sports athletes, and then he started questioning, now, what is it about these extreme sports athletes that allow them to get into these peak performance states where they've seemingly been able to exponentially increase the level of difficulty of the tricks and their accomplishments in such a short amount of time. I think they talk about in the book, when you compare extreme sports athletes to things like what we would consider traditional sports like soccer and tennis and football, when you really look at those sports, if you look back, a few decades ago, probably a little has changed, but it's not a dramatic difference, and athletes have gotten bigger, stronger, and faster. Now, if you juxtapose that with extreme sports athletes in just a mere matter of 4 or 5 years, or even sometimes maybe a little bit longer, but decades, you have these wild swings in the abilities where the athletes in motocross are hitting double backflips, and 10 years ago they couldn't even do a single backflip. And you just see all these different areas of extreme sports where seemingly the impossible becomes possible. And I think the concept is, by getting in these flow states where they're putting the athletes in life and death situations, the that actually that intense focus required for them, where the consequences of such are death, allow that person to seemingly achieve the impossible.
There's this prevailing theme throughout the book about the extreme athlete or performer being put in these intense situations that require near perfect performance, which then induces this flow state that otherwise could result in some dire or even fatal consequences. And as docs, we're almost put in this position by proxy, because although the consequences could be fatal, it's a little bit different for us. So does that still constitute a flow state? We'll explore that idea a little bit more. But first, Wolfie, have you ever been in the flow state?
I definitely think I have been in flow. That being said, I don't know that I've ever been in a flow state quite similar to what some of these extreme athletes are experiencing. I've never gone on a 10-day kayaking trip on a very dangerous river by myself and had that experience where I feel like I am the water and the mountains and all of that. I definitely can look back on some times where a lot of that sensory input and that sensory overload has just disappeared from around me. And I feel like I've really honed in on a single task or a single event in the emergency room. I remember snapping out of that also, and it all hit me where I was just so focused in. A couple times that's been in fairly chaotic code situation. Other times it's just been on a complex laceration repair where you just hit the swing of things just right. And before you know it, it's all over.
How about you, Marco? You ever been in a flow state? I mean, you've been doing this for multiple decades, so
1+ decade, but I guess that counts. Yeah, I think actually emergency medicine and maybe many other specialties like surgery and things like that probably lend themselves to flow quite easily. Um, I think there are certain criteria, and perhaps we'll get into them a little bit later on. But I think when you peel back the layers, you can see how being in these complex situations where it requires rapid decision making, and even though it may not be our life, like you alluded to, we're often in these life or death situations which require this rapid decision making process, right? So, what are some of the criteria? Well, it have to be clear feedback, right? There has to be attainable goals and clear feedback on whether or not you're progressing or doing the thing right. And I think we're in that situation pretty regularly in these life or death situations of cardiac arrest. Are you getting ROSC or you're not getting ROSC? It's easy to see when you're kind of the captain of the ship or at an attending level where you're giving responsibilities to other people, how difficult it could be when the goals or when the tasks are way outside your comfort zone, how you can almost see that deer in headlights look. It's like there's just so much stimulus coming at any particular person at one time that it's very easy to get lost and feel overwhelmed. But being that person that's in charge and siphoning off those tasks to other people, it's like, well, now you're giving that person a clear goal and a specific task on something they can handle. And whether that task is okay, I need you to do chest compressions. I need you to do the bedside ultrasound to look if we have cardiac contractility. I need another member of the team to do airway. Well, now we're siphoning off and breaking down these tasks into more simpler things that that individual may be able to handle. And they can probably easily get into flow just in that single task. I think we're all experienced enough to know. You think about your last intubation or even your very first intubation where you get kind of almost tunnel vision and you're just unilaterally focused on like, all right, I got to get the tube through. I got to get the tube through. The alarms are going off in the background. The person's pulse ox is dropping. And it's just like, no, I'm focused on the tube. So it's very easy to kind of get lost and see how we could get into these situations pretty easily.
it's interesting that you say that because my very first intubation, and of course, this is in the middle of COVID, so you have minimal information coming in from EMS. Family can't come in, but it was a gentleman who had it came in as a fall, and then of course for us he was altered, so he was way too altered to the point where he wasn't protecting his airway because of it was a fall. They also called the trauma alert, and it was my first intubation. My attending just hands me and he says like, "Go for it." So I'm intubating. I couldn't find the cords. I was stressing out and I took that deep breath. I was looking at the video and I could hear his voice talking to me. And then all of a sudden I heard somebody like just randomly starting to count down. I think it was like 80, 78, 76, 74. Oh, there are the cords. So I just put the tube in and we start bagging them. And I looked up and I realized that the numbers they were counting down were his saturations, suboptimal clearly when he's in the 70s. But somehow, this was my first intubation on a real person. I was still able to block that out and do these goal directed things like you were talking about. A lot of times, being in this flow state is a retrospective thing. You don't always know that you're in it because you're so focused on everything that's going on. But once you're out of it, and I think Wolfie, you had mentioned this earlier, you realize, wow, I just did this. I was probably in this flow state while I was going.
It's really interesting that you bring up that you were tuning out all of those things from your first intubation. I actually remember my first intubation was also in my mind. It was a very quiet moment until I snapped out of it, and you hear the alarms and the people in the background yelling and the side conversations. I just thought that was kind of interesting. I have a very similar memory of my first.
One of the things that the book talks about, and I think there's a total of 10 criteria, some of them have to happen. Like Marco was saying, there has to be this instant feedback, it has to be goal directed. But one of the things that talks about is being in the state of flow is there has to be a positive outcome. My question to both of you guys would be, is us as emergency physicians, if we're in the middle of a trauma or if we're in the middle of a code and we're in flow, but yet that patient doesn't have a very good outcome, does that mean that we actually weren't in flow? Or does that mean that as EM providers, like our version is just a little bit different?
The way I interpret it is it's not a positive outcome, but it's a positive experience. Because I think if you look just at the history of these extreme sports athletes, how many people have died from it, and even kind of what we do. Now, do we think that that person wasn't in flow just because they're doing something ridiculously challenging and potentially, at least personally rewarding. And same for us on a clinical shift. So I think the experience has to be positive. I don't necessarily think the outcome has to be positive. So whether or not the patient that you're taking care of has a good outcome doesn't necessarily mean that you weren't in flow. And I think we would all say that, the vast majority of the patients who are in these critical illnesses like cardiac arrest, unfortunately, they're going to die. Doesn't necessarily mean we're not trying as hard or that we're not getting into that singularly unilaterally focused situation where kind of drowning out all the noise around us. So I don't think it has to be a positive outcome. I think it has to be a positive experience.
And your definition of outcome can also vary here, where, I would say that the vast majority of these patients that are already critical are not going to have good outcomes. Your outcome personally is, did you do a good job managing that patient? You can have a perfectly run code, you could have a perfectly run resuscitation, and still have patient death. And that doesn't necessarily mean that you did anything wrong. If anything, you may have done extraordinary and still just not had the outcome that you were hoping for.
That's a fair point, because a lot of times, especially in emergency medicine, we need to set those expectations. Sometimes we'll say, oh, we had a good outcome because we saved them. But I think in reality, we know that that's the furthest thing from a good outcome. I think that that's a good point. One of the things in the book they talk about is both micro and macro flow. Dr. Propersi, you had touched on the fact that sometimes you can delegate tasks to people, and maybe that's the macro flow because that's the larger picture. You're the general, you're the one quarterbacking and telling everybody what to do. But then we also have the micro, which is like our intubations. We're the ones that are doing those things. So how do you think that the macro and the micro flow states come in throughout our day-to-day job and also contribute to what's going on around us?
For me, it's interesting because I feel like whether it's purposely or just because my body is subconsciously searching for these dopamine releases, but I often set my clinical schedule and even my personal life up to try to achieve the criteria or the circumstances that would contribute to me feeling some focused, uninterrupted time. And one of the first things I do, actually, even on shift when I'm working with residents or even myself, is try to set clear goals. So, what are the goals that you have for myself? And a lot of times we're not going to necessarily achieve them, but sometimes the goal is like, okay, I'm in a fast track situation. I have 3 nurses. I got 3 residents. All right, we're going to see 45 patients today. It seems kind of silly, but just having that goal, like something to look towards, means like I'm going to push myself really hard. I'm going to take care of some patients. So I think on some small or large scale, just setting yourself up for success can put you in those situations, whether it's on a micro level or a macro level. I actually think intubating is probably putting you more into macro flow, right? Because you're in this really extreme situation where I think we take it for granted as emergency medicine physicians because it's just like selection bias. We're surrounded by really smart people who are also capable of doing some of these amazing things. But if you told the average person walking on the street that you had to cut somebody's neck open and put a tube through it because they had angioedema of the vocal cords, they'd be like, holy shit, that's some crazy friggin' experience that you had. But on a smaller scale, I think like microflow actually is setting these goals up for your shifts. Okay, today I'm going to do 5 ultrasound guided IVs, 5 of these things. You're already setting the groundwork to put you into these kind of intense focused situations. Even when you're like rounding the board, right? So when I'm working with residents and we're rounding our board, and we're saying, all right, like these are the 10 patients I have. What's pending on them? These are the things that I need to do to move this patient forward. These situations are giving you clear objectives, clear goals, and they're probably putting, especially interns or people who are junior learners, I'm giving them goals that perhaps are just out of reach, or they're going to put them like out of their comfort zone. Hey, I really need you to call the cardiothoracic surgeon on the phone and tell him that you need him to come in to see a patient at 3 o'clock in the morning. That might be just outside their comfort zone, So having those clear goals and those discussions, I think that's you're setting up the criteria to put you into those experiences.
For all those cardiothoracic surgeons out there, you can send your complaints to Marco Propersi at... No, I'm just kidding. Yeah. No, I think that that's definitely an attending perspective. I remember as an intern, my goal for the day was to pee twice and get an IV, and I was accomplished. I felt good with that. As you get a lot more experience, you're able to manage a lot more things. Then I've also found that as you're able to manage all of those things, you feel like things are flowing much better because you're able to control and determine the outcome of a lot more than just very simplistic stuff.
Yeah, it's interesting you say that because one of the things I'll often tell junior learners and medical students is when they're presenting a case is they have to understand that whatever they're going to present, I've likely heard thousands and thousands of times. When I'm solving a problem, I'm solving it for probably the hundredth and perhaps even thousandth time. So a lot of those decisions I've offloaded already to my implicit decision making system. So it's not something that I actively have to think about often because I've solved that problem so many times. When you're seeing a patient with chest pain or abdominal pain, your clinical judgment, your acumen, your gestalt, like that is defined by every single patient that you've seen with that same condition beforehand. And if you've seen 10,000 or 20,000 chest pains and abdominal pains, you have this mental model to work with. And since I've solved that problem so many times, like I don't have to really stress about a lot of minutia because I've gone through this process so many times versus a junior learner. It's like, this is literally the first time they are taking care of a person with rapid AFib. So it's like, how do you spell cardizam? What's the dose of cardizam? Is 25 milligrams too much? Does this person have renal failure? How is that going to affect the medication I'm giving? So first time you solve any of these problems and you ask yourself these questions, obviously it's going to be a lot of almost like mental exhaustion that you're going to see because it's like a hard thing that we're doing here.
One of the things that they talk about in the book, I think they were talking about the guys who are in like those flight suits or whatever, jumping off the building. When you're going through a process, your body is always doing these sorts of checks, and there's an expectation that this is what's going to happen. This is what's going to happen next. And when everything happens to plan, your body doesn't think about it. But it's when one of those checks don't work out, that's when you have to start thinking and dealing with some of these situations. The reason that we get into a flow is because we are faced with disastrous situations. One of the things I wanted to talk about, and this is good to get two different perspectives, both from Dan and Marco being an attending. Have you been able to figure out a way that potentially sets you up to go into flow easier? Because again, there has to be certain things that align in order for that to happen. And maybe over your decade or more of experience, you know that these patterns are going to start occurring. Are you able to set yourself up a little bit better to get into flow?
Yeah, I think yes, in probably my personal life and even in clinical life. So I think clinically it's about preparation. So I often tell the residents when you hear the red phone call or the ambulance phone, it's like you have to steal that time, right? So they're telling you that a cardiac arrest is coming in or a person with asthma is coming in or trauma is coming in and they're 5 minutes away or 10 minutes or where we're at now, where you trained and where I'm working currently, it's sometimes you have these really long transit times. I almost think that's like a freebie, right? They're giving you time. It's like they're giving you the board question. So now you have time to kind of look it up and see. So you should be taking that time to figure out, all right, I have this person in with cardiac arrest and these are the particulars that they're giving me. In the worst case scenario, what should I be prepared for? And you're going down your algorithm before you even get there. So when the patient comes in and you deal with some potential complication, in your mind, you've already worked through that. And the same thing with the airway, right? So what is your first attempt going to look like, right? So are you going to go direct? Are you going to go video? Are you going to use a bougie first? Or you're not going to use a bougie first? Are you going to use a salad technique because the ambulance told you that they were coming in with hematemesis or something like that? Is this a person that you look at and you say, okay, like this looks like it's a difficult intubation. They have a beard, they have a big fat neck, they have no chin. What if I have to crike them? So I think preparing for these things mentally, you're already offloaded that decision somewhat, and you're giving yourself the freedom to make the decision when your first attempt fails at something or a second attempt or even your third attempt. Now, when you're getting ready to do the procedure, you have to have all these things already kind of laid out. If something doesn't work, you didn't fail. This is just part of your decision that you've already made. And because some of that planning is like you're setting your goals, you're setting your lineup, so to speak. It's like you're not panicking when something doesn't go the way that you've decided. You're just moving through your process and you're really able to stay in that intense focus instead of responding to some alarms or somebody else in the room. So you're just going through your plan. So to me, it's preparation and kind of setting those clear goals up front. If this happens, this is the next thing I'm going to do. If that doesn't work, then this is the third thing I'm going to do. If that doesn't work, then this is the fourth thing I'm going to do. So you're just staying kind of in that zone through the whole time until you finish the procedure or taking care of the patient or whatever it is.
Wolfie, why don't you give us a little bit of insight on your experience, the guy who always walked around with an 11 blade in his pocket. How have you been able to set yourself up to get in flow in those moments where you really need it?
So, I hadn't actually thought about training in flow or starting off in flow or somehow like bringing myself into that scenario until after reading this book. But then I kind of started to realize that there are certain things that I do that do kind of allude to that already. And I think one of them is being prepared, as Marco was saying. I looked back and I think that central line procedures are really one of those spots where I do feel more in flow. I feel like everything is tuned out except for the immediate task at hand while I'm doing them. And one of the big things that helped me get there was that I do it the same every time. I set up everything exactly how I want it. I know exactly what my first, second, and third approach is going to be if something doesn't work. Fortunately, I've been doing it long enough that I have backup plans and workarounds for most of the common complications. And so just having that first, second, and third approach in hand already, I think has helped me to get there. The other thing is I really like Marco's suggestion of setting goals at the beginning of shift. I think having an idea of what you want to get out of an experience before you actually go through it definitely helps set up for success also.
One thing that I learned, and think this is a huge testament to some of the attendings that I trained with, is Marco had talked about you get that freebie of 5-10 minutes before a code comes in. The most chaotic times in the ER is when something exciting is coming in and everybody wants to help and everyone wants to be part of it. And people are putting on their gowns and their PPE. And if we can control the room and then just say, okay, I need one person on compressions. Who's going to be the person to replace them? Who's doing medications? Who's doing my line? And preparing for everybody has the role. Everybody knows what to do. Who's going to be backup? Many times we do all this stuff internally, but just by bringing that out into the ethos and verbalizing these things, we help communicate with each other. Hopefully that's an on-ramp for us to be able to get into flow. Marco, I wanted to ask you about something you had made this delineation of in my work life and then in my personal life. And you talked about the ER aspect of things. How do you set yourself up for flow? I mean, I know you have a crazy schedule. You have more initials after your name than before with all your titles. How do you set yourself up in your day-to-day life?
Yeah, it's a good question. I think it's not so dissimilar. For me, it's about goal setting. I've read a lot of books, and it's interesting how much I've just kind of naturally led towards similar type books. And obviously, flow is like an extreme sports athlete kind of thing. And we're not really in that type of environment outside of clinical medicine, but we often have a lot of things that we're trying to accomplish in our life, kind of outside just that clinical aspect, right? So whether you have an academic position or some administrative position, those things often come along with some job responsibilities. But beyond that, we all have things that we're just passionate about. Okay, so it's what makes Will Smith, what makes Dan Wolf, what makes me Marco. And part of navigating life is figuring out, what do I want my life to look like? What would be successful for me? At the end of the day, when I shut my eyes, like, did I do some good in the world, or did I feel like the person that I want to be? And I think the key is just figuring out what are those things that are must-haves in your life that make you the person that you want to be. And some people, it's easy. They find their thing immediately. Or for instance, in medicine, it's, subspecialty training. I want to be a toxicologist or an ultrasound fellow or this or that or a cardiologist. But outside of that, I think I plan my week according to the things that I think are musts. And these are the things that I feel make me the person I am. And then I schedule out time for those things. And honestly, a lot of the things are things that probably nobody else would care about, but they mean a lot to me. So participating in stuff for Rebel EM, recording this podcast, writing blog posts. I have goals every week, every month. And I actually do a weekly review on Mondays, and I set up my schedule. And what I would say the easiest way for me to figure out how I'm going to get into these kind of flow-like experiences, I read this book called Deep Work by Cal Newport. And I set up focus time in my life, and it could be blocks of however long you need them to be. And these are distraction-free times where I shut off most of my electronics. I have a few apps that I've downloaded that will block the internet. They'll block the ability to use the computer in your typical way where you can't get on some of these distracting aspects of the computer. And I'll just do the thing that I've planned to do. For me, that happens to be generally around 3:00 in the morning. I'll set my alarm. And I have a plan for what I want to accomplish during that time for that deep work session, and I do it.
Don't worry, Wolf. I'm not going to make you follow that one up. Personally, I can say and attest to, after rotating on admin with Marco and seeing this extensive organization and how easy it was. Let's say making a podcast for something, like you want to figure out the ideas, the guests, the topics, the communication, and it takes a little bit of work to set yourself up for these things. But once you use it and then stick to it, which is maybe the biggest part, it does make things run so much easier and you feel so much accomplished. And because you're more efficient, you actually have a lot more time on your hands. Sometimes it's just as silly as having a certain app to go to when you need something from the grocery store, or needing to respond to emails either right then and right there, or you have this time set aside to deal with things that take a little bit more time. And it really helps you manage the kids and the wife or the job or the posts or the podcast. You're able to help manage all these different things. Not only do you not have to think about it and worry about if you're forgetting stuff, but I think the outcomes on all of these things are significantly better, which is ultimately the whole goal of achieving this stuff. One of the interesting things that was brought up in the book, they talked about Malcolm Gladwell. And if you guys aren't familiar with the 10,000 hour idea, is it takes basically 10,000 hours to achieve mastery in a sport. So I think they brought up LeBron James. And again, this is in Gladwell's book. But talk about how that was a little bit misreported. And it's not necessarily 10,000 hours makes you a master at anything. You bring that into residency training. You're doing all these things so that when we're on our own as attendings, we're able to solve these problems and deal with these situations. What do you think is important in residency training to help junior learners to better prepare themselves to get into flow when it's not just stuff that you can pre-plan for, like you actually have to be able to execute?
I think the 10,000 hour rule kind of oversimplifies it, but I don't think the purpose is for this 10,000 hours to be like a hard and fixed rule. I think it's more just kind of almost a metaphor, like an anecdote to show people when they say, or and I gave this example of the medical student presenting a case to me that I've heard a lot. And I think the point is that when you see somebody who's operating at the top of their game, you're only seeing what they're showing you for that moment. And oftentimes it's natural for people to say, oh, it comes so easy to you. You're a natural, you're super talented. But what that person's not seeing is the quote unquote 10,000 of hours of effort that you've put in before that, right? So they're only seeing the product. They're not seeing everything that came before to get you to that point. And it's funny because I tell either students and residents who are both awesome and high performers and who are struggling. And I remember I got really good feedback when I was an intern. I probably was at the bottom of my class in intern year, and I got some really good feedback on some of the things I was doing wrong, and it hurt me a little bit. But it was very honest. It was very direct, and because of that one moment where my attending respected me enough to give me this really specific feedback that it wasn't that it was what he was saying was mean, but it, it hurt my ego. 5 years later, as I did EMIM, I was chief resident, and I owe it to that very strong, very direct feedback. I think some of it is we're afraid to give feedback because we're afraid to hurt people's feelings. But I think in that situation, we're doing the learner a disservice because by just kind of giving them the old high five or slap on the shoulder, good job today. What are you really giving them? Nobody's done anything perfect, including myself. So there's almost always something that you can give them that they can take home with them. They could do better the next time to sharpen the knife. I think the real key is they have to like run to the fire. So if you're training, what the purpose of they were saying in the book was that it's like more like 10,000 hours of deliberate practice, not just 10,000 hours of exposure. And I think about it being in medical school, it's like you're reading about some of these cases and just like, oh, I read about a cardiac arrest or a CHF. And how memorable was that? It's like you probably read the same information a dozen times and couldn't remember anything of it, but you passed the test and you moved on. But now you have one specific patient who happens to be in CHF and you have to intubate and you have to make all these phone calls to consultants and get them admitted to the ICU. For years, you could probably tell me like very specific information about that particular patient, like what medicine you gave them, what room they were in, what consultant you talked to, were they mean or were they nice, were they rude to you, the discussion you had with the patient's family after there was a bad outcome, or the son, or the look on their face. So the whole point is kind of what they were alluding to in the book, like an hour learning something in flow, or perhaps in a residency situation where all these things that you're learning are really tangible. You can feel the emotion behind them because you're really dealing with them yourselves, versus an hour reading something from a book. I mean, there's absolutely no comparison. Yeah, I think that 10,000 hours is probably a little bit either over or understated because it really depends on how intensely focused you are during that time. But it's more of just a metaphor in my mind. That's the way I interpret it. It's not about the specific number of hours. It's just like, hey, this person's worked really hard to get to the place where they are right now. And what you're seeing is the byproduct of that.
Piggybacking off of that, and we'll go to you with this one, Wolfie. Marco had just talked about like the idea of an intensity of learning, whether, you're spending an hour doing this versus reading. How did you feel after coming out of your ICU rotations, dealing with more critical patients in the emergency department? Because for the past 4 weeks, you'd been working 80 hours a week to be able to deal with these patients.
Coming out of an ICU block, you're fully immersed in that. You basically don't live at home anymore. You're just in the hospital. You're just dealing with the critical patients. I think that kind of alludes to some of the things that some of these super athletes go through is, they find ways to immerse themselves, whether they are isolating themselves or surrounding themselves with other people that are doing similar things. I do think that coming off of an ICU block back into the ER, you're primed to handle those very sick patients when they come in. It's all you've been doing, it's all you've been thinking about for the last 30 days or so. Going beyond that, even, you're getting direct feedback in the ICU or in those critical settings. And you're getting very targeted feedback. Did the patient die or not? Are they getting better or worse? It's very quick feedback. And so I think that ties back into this last question of 10,000 hours and what is actually being accomplished in those hours. Are you getting really good feedback, or are you hearing nothing and you're just hoping that you're doing the right thing? This kind of immersion, whether it's isolation, whether it's surrounding yourselves with it, I think that really does facilitate the learning. And so that's kind of the entire premise of this book, is that you can use flow to accelerate that training time so you can accomplish more with less.
Wolf, I think we'll stick with you on this last question. We've been talking about flow state, going in, going out, the extreme situations and when we can use it and how beneficial it is. What do emergency department doctors need to know, and what can we get from this book that can really enhance our practice both inside the department and outside as well?
Interpreting max performance, whether that is in extreme sports or whether that's in the emergency department, I think it distills down to being able to focus very specifically on a task. You get your feedback and then you execute immediately. And there's lots of different ways to do that. Specifically, I think getting into the mindset to actually utilize that in the emergency department, kind of setting up your expectations, setting up your shortcuts to get into that state so that you can perform maximally.
You have anything you want to add to that, Marco?
Yeah, I think we all did a just great job of hitting the high points. And again, kind of somewhat speaking tangentially, because this book is not necessarily about medicine, but more about life. But I think the key points that you should remember either on shift or even just your life is that you shouldn't really just go to shift or even attack life just kind of floating around and waiting for things to happen to you, right? So I think setting those clear goals for yourself and then running into the fire, that's really what's going to prepare you and get you into that mode where you're immersed, like Wolfie was saying, where you can really just jump into that task and push yourself way beyond your boundaries. There are lots of things that scare me all the time, even in emergency medicine and outside of emergency medicine. But if you don't run towards them, you're never going to get better at them. So setting clear goals, running into these situations that are perhaps a little bit intimidating, especially as a junior learner and even as an attending, that's the way you're going to push yourself beyond your boundaries and kind of sharpen that knife and just get better at it every single day and just kind of keep attacking it.
So we are talking about The Rise of Superman by Stephen Kotler. Again, I'll make sure that we link a link to the book in both the show notes and on the blog post for anybody who is interested. Gentlemen, thank you so much for joining us today, taking a time out of your busy schedules to talk about this book. Hopefully we can do it again.
Hey, thank you for having me.
Yeah, well, always a pleasure. I'd be excited. Let's do it again often.
Sounds good. All right, guys, take care, be well, and we'll see you next time.